right, well, without further ado, I think the time is here. Welcome to our latest webinar and our first webinar since the global pandemic started in earnest around the world. Obviously, some of our colleagues in Asia were dealing with it earlier than some of the rest of us. But at this point, yeah, we're so grateful for those of you who have internet at home, Wi-Fi, that you could choose to log in. I see some people, even from their video, are logging in from work. So glad you could make space from your hospital, however you're being used. We're so grateful for you and for the work that you're doing around the world and pushing forward the cause of comprehensive cleft care for families affected by cleft. So today, as you've seen, we'll do a quick update on where we are with the Circle of Cleft Professionals. We did have a meeting of the sponsors, the sponsoring organizations, just on Friday, which you'll see the list of sponsors in just a second. But all of us really moved by the experience that you have in trying to promote and continue care even amidst this pandemic. And also looking for ways that we can work better together. How can we support comprehensive cleft care in a more focused and strategic way at this particular time? In particular, looking towards what's next. And we'll have some specific discussions of that, as you can see, coming up in May. The idea of how do we talk about rehabilitation in the era of COVID-19 from an ethical lens? How do we make that case to our own hospital administrators or to our Ministry of Health about the importance of comprehensive cleft care as we move out eventually from this pandemic crisis. So we'll talk a little bit more about at the end of the webinar, which is meant to run about 80 minutes for 60 minutes again today. And I just see people continuing to enter from the waiting room, so it's great. Thank you. Welcome to those who are just joining as we start now. So moving along. If this is your first time to the Circle of Cleft Professionals, just a quick reminder, what are we all about? Well, we're about facilitating collaboration, we're about communicating impact, and we're about supporting local teams in the growth of comprehensive cleft care. And this topic this morning, obviously, or this afternoon or this evening, is one of essential import to our move towards comprehensive cleft care, what you can do before surgery. By the numbers, we're over 162 members. Some more were coming in this week as people potentially have some more time if they're stuck at home or if they're looking for ways of collaborating well as we move forward and through this pandemic. That's over 15 specialties and across 32 countries. So you'll see the majority of us are working in orthodontic speech or surgery specifically, but there's still many other disciplines and specialties represented. And of course, obviously, all of us really committed and impacted by how we get comprehensive cleft care off to a good start. So you can see a little bit of where our members are from so far. The green dots are where we have 10 or more members, so you can see United States, Canada, Chile, Argentina, India, Ethiopia being some hot spots so far, but we're continuing to look to grow. And so that's one of the discussions that we've been having with the sponsoring organizations. How do we use this time effectively to grow how we do so we can share resources and encourage one another toward providing really good care in the midst of this, if we can, and then also moving out of it. So, as I continue to admit people from the waiting room, here are our charity supporters, our sponsors from around the world who have provided good content for these webinars over the last year, and we'll continue to plan to see how we can work together effectively during this time. So again, my name's Hugh Brewster. I'm the Executive Director of Transforming Faces. If this is your first time joining us, we're delighted to have you. And one of the organizations that's been really pushing the cause of comprehensive cleft care for a long time is Fundación Gantz in Santiago de Chile. And so it's my delight and I'm privileged to introduce Dr. Marina Campodonico Frisch from Fundación Gantz. And really, as you can see in the description here, she's been really focused on pre-surgical care, among other things. She's trained as a pediatric dentist at Universidad de Chile. She's a member of Fundación Gantz CCC team. And many of you have heard of her already through conference presentations, teaching, and even the co-author of a chapter about cleft care from 2008. So we're delighted to have her join us today. She's been a long-term friend of Transforming Faces and a member of Smile Train's South American Medical Advisory Council as well. So Dr. Marina, I'll invite you now to share your screen, and for the next 25 minutes or so, Dr. Marina will take us through her presentation today, saving at least 30 minutes for us to talk in question and answer. You can type your questions in the chat feature. It could be in Spanish or in English, and really to take some of these topics deeper and how they apply to each of our own contexts at this time. So Dr. Marina, please feel free.
Hi, Hugh. Thank you very much for the invitation. We have been friends with Transforming Faces for many years from now, so it is always a pleasure to be with you and support your training and the cleft, comprehensive cleft care we are working with for, at least for me, for more than 26 years. So thank you very much for the invitation. The first time I personally worked or was contacted in Fundación Gantz was with my mentor, my beloved Dr. Alicia Kurt. And I was pregnant for my second child, and she invited me to just visit Fundación Gantz. They had just moved to the actual location. And well, and since then I'm there. It was so quick and so easy. And Fundación Gantz is one of the first private entities working with cleft children, and we only work with cleft children and syndromic cases. So we are really focused and centered in seeing cleft children and cleft patients. As you see, the Fundación Gantz works since 1985, and 15 years ago, they also began to run our own surgeries in our own center. So we really do a very integral stuff. And we admit 230 new patients a year, and from then 180 are primary patients. So many of them undergo afterwards pre-surgical orthopedic. We have a very interesting team, interdisciplinary, and we include professionals. They really have a high expertise. And as you can see, we have a group of plastic surgeons, anesthesiologists, genetists, and ENT. And also speech therapists, we who perform NAM, general dentist, orthodontist, pediatric dentist, maxillofacial group for the last year. And we have also our nurses who are a big support for our work, a psychologist, kinesiotherapist, and psychologists who support our children. So we really work, as you see, in a very cooperative work. And usually when we do some training, we try always to add our whole team. So in this picture, you can see our NAM team. We have seen more than 600 new cases of NAM in the last years. Doctora Carolina Gutierrez here, she's now our chief in the dental area. We both also work with NAM and pre-surgical orthopedic. Dr. Grayson, who was our mentor in pre-surgical orthopedics, and Dr. Carlos Giuliano, who is the medical director of Fundación Gantz. So we really are very pleased to work in a team and to have the support not only of the dental area, but of our director and the whole group. So for us, it's really important to work in a group and to support patients in an integral way. And comprehensive cleft care, as we all know, is not so easy. It requires a lot of work together. And every patient is different. Despite they are all born with a cleft, we can see that all the clefts are different, and this individual situation of any patient is also different. So we really need to focus in the patients, and each case requires a special treatment. So we are looking for the best results, and furthermore for the best quality of life of the child and the family. And that's why we need to work all together. We are really taking our patients and the family by the hand and helping them go through this road that not always is so easy, but we can help them to go to the end and do the way in a happy and a healthy way. And I will start the speech with a letter who one mom once wrote me, and I think that's really what's happening with the patients, because they don't know exactly what to do, and they try to do the best for the child, and this one is not always easy. Sometimes for them it's also difficult to understand really what's the best for the child, and the best would include love, understanding, and support to reach a normal life. And the source of such not only comes from us, the parents and the closest family, but also from everyone around them. So we are all involved: doctors, dentists, speech therapists, teachers, and as she says, it's not always easy. But they finally see that the road has been worth when they see the child smile. And probably if I didn't say it was Benjamin, you were trying to find out which of those children is the one who was born with a cleft. So since we have prenatal diagnosis, we have to begin to support the parents, just not after the birth, but before. So we really have to explain then all the procedures and all the process they will go through to go to the end result and to have the surgery and have all the treatments for developing a good speech and all the areas we really try to support, to do the orthodontic treatment, to have a psychological support and everything we need. Usually when we see the baby at the first moment, we see that the parents could feel or are involved with a lot of different emotions, and they could feel depression, grief. They have a lot of cultural issues. Many times they try to say that it's the mother's fault that the baby has a problem, or it's the family of some of the parents. And that's a difficult point, the family and society, how to present the child to the society. And this leads to confusion, to anger, to sadness. And that's when the interdisciplinary work is so important, so that we all speak more or less the same language, and not that we confuse more the parents. We try to really focus on what we are trying to transmit, and to speak, everybody in the team say the same things, understand how the comprehensive cleft care works, how we have to go through all the different areas of the treatment, and so we can support the parents and help them to be more focused and not to be so overwhelmed with so many different emotions during the treatment. And so we began to explain them all the different moments of the treatment and how they can go through all the areas, always focusing on the best results and the best quality of life for the child and also for the parents. And so we sometimes have to be a little bit, my mentor always says we have to treat them with loving firmness. and to tell them, stop to say my poor child. I'm sure everybody of you have heard at some point that the family or the parents said, oh, my poor child, my poor baby, my poor boy, or my poor girl, how was it possible, and so on and so on. And so we have to be very loving but firm to say to them, if you continue to say this to your child, he will be a very impaired child. But if you stick there, you treat them as normal as possible, and also to the grandparents, you say, you know, you need to support them and to make them feel important and not a poor child. So we always try to support them also in the emotional way. And due to the fact that during the pre-surgical orthopedic, we will be constantly looking after the child during at least 3 months, we have a lot of time to support them and to support our work team also. So here we see that we try to transform the fear, giving them knowledge and caring for them. And when they feel sad, we try to transmit them that they have to be strong and they can develop strength inside to help the child in a better way. And we have to be kind because they have a lot of issues, family issues, they feel sad, and we need to make them feel confident and that they commit with the treatment, understanding that sometimes they can be depressed, but if we give them the good support, they finally will commit with the treatment as we commit with them during the treatment. And so all the insecurity, because they also have a lot of information in the web, you know, today when they find out that they will have a child born with a cleft, they search the internet and they see everything, and they don't always have the criteria to extract the good information and to know what's really going on in each center. So we have to try to teach them how to focus in the best information, and so they slowly will be more confident and will understand how the treatment of his child will work. Nurses are also a big part of our team. They give the parents support, they teach them how to feed the child properly, and that's very important, because one of the, I would say, biggest worries of the parents is how I will feed my child properly, because that's where everything starts. If the child didn't feed properly, nothing will go on properly too. And so many times when we go and visit our patients at the hospital, they have a nasal tube for feeding. So we began our work at the hospital and we take the impression, and the baby gets his appliance and the tube goes out. And of course, this improves the quality of life of the child, and the parents are more confident to giving them the feed without all the stress of a feeding tube. And many times we also have to help them a little bit and support them and try to explain them that the treatment can be easy, that feeding is not a big issue. Sometimes it is, we know, but we have to transmit them confidence and try to show them that things can be easy. Despite they are sometimes serious, but they can be easy. And so the parents feel confident, and the child will be more happier, more less stressed. And when the mother is less stressed and the child is less stressed, everything flows easily. And we not also have the professionals to support the parents, but also they have the other parents. And when you work in a center where we only see cleft patients, they support each other a lot. But we also have our staff, our secretaries, and everybody is there to support the people and the patients through the treatment. And when we begin with pre-surgical orthopedics, we have first of all to explain what about the treatment, how will be the different stages be, that we will be following the patient every week. We give them the emotional support, and we give them a lot of answers for the questions they have, because they are afraid, they don't know what's going on. Sometimes they talk to the surgeons, and we love them, but sometimes they are, in Spanish we sometimes say they are the Dios Torres, so we mean they are like the gods of the team, no? And the people, the patients, the parents sometimes are so nervous that they are not able to ask all the questions. So we are there every week to giving them support, to helping them. And so we try to transmit the parents that the team are all of us, the doctors, the nurses, the speech therapists, all the other dentists in our team, and they, the family, the child, the grandparents, all the family who supports them. We are all part of this big team trying to work together for the same goal and the best results for the child. And so we have asked this question many times, to do or not to do NAM. It has been a point of discussion since I'm part of the cleft work. And we do NAM since 1998. And we really have had a good experience and very good results. We explain the parents of all the stages of the treatment. And of course, there are patients who are more helped out with the treatment than others. If you have a small cleft, you don't need NAM. But if you have a bilateral cleft or a bigger cleft, it will help to improve the results and to prepare the patient for the surgery afterwards. And so here are all the different stages. And what we try to do is, I usually work always with the parents on my side. So when I take the impression, the parents are there with me, so they can understand what the treatment is. And despite taking an impression is a very serious situation, you have to do it really with all the knowledge possible you have, but you try to do it easy and simple for the parents, so they understand that they can be part of every step of the treatment, and they began to understand what it means, how important it is, and then you will have the best friend on your side, and you have the best parents to support child's treatment. And so we have some pictures from Dr. Carlos Giuliano, who is our medical director, and you can see the difference between the child before the NAM and after the NAM. I think it's not in discussion that if you can do the surgery in a better situation, the outcome will be better, the surgery will be safer, the scars afterwards will be less. So I think despite any concerns about the technique, I think everybody will agree that it is easier to do surgery in this patient than in that other one. And here are the results, and the child has not the classical nasal stigma of a cleft patient. We saw before, and it was one of the things that moved me to do pre-surgical orthopedics after we saw the results of the treatment. And here we have a unilateral case, and you can see the results. And probably this cleft without NAM would have nasal stigma, and it probably would require more surgeries to really get the results we are expecting to have. And we also have to to take care of the skin of the baby during the treatment. We work not only with the alveolus, we also work with soft tissues, and it's really important to take care and to explain the parents how they really can care, so the tissues will stay healthy and will not have a problem after the surgery. And here we can see how NAM works, how we can manage properly the alveolus and put them together so the surgeon can perform a better surgery. And also the parents will feel that they are part of the treatment. They feel when they can help and we show them each stage of the treatment, they get involved, they feel comfortable, they feel committed, and they will be our best guide also. If we take, we keep looking after the parents and listening to them, we will learn a lot from them. How we can improve some technical management of the tissues. We have been moving all the adhesive system during the years, and the parents are very supportive if we are there for them too. And so we can see how the child is growing and how he is going through the different stages of the treatment, and we follow them during the days, years, and it's so rewarding to see how they improve, how they integrate into the society, how they do well at school. Many of them like to sing, and it's really rewarding for us. And for doing all this, of course, we always have to be training our peers. Since 2004, we did a big training in Chile because the cleft care is part of our public health care objectives. And so we did teaching of NAM around all the main hospitals in all our country. And here we have some training opportunities. And as you see, we always have not only the dental team, but the anesthesiologist is with us, the medical director. We met people from all around the world. We tried to do hands-on so everybody can really find out how the technique works and how they can do to perform in a better way. Of course, we need to be committed with the treatment, to be empathic with the patients and the family, develop skills. NAM is not so easy to do, but it's really very rewarding if you do it properly. You have to have all the knowledge, you have to study, you have to attend courses and congresses, and you have to be very kind with yourself and kind with the patients and their family, because sometimes it's not easy. Sometimes we get frustrated because some parents don't stick to the treatment as we would like to have it, or sometimes the child has another pathology and we can't have the results we expected with NAM, but we always can improve and we always can turn everything to a better situation. So we have to be there and to support all the team. And here is a letter from a mother who was really very important for me, because she gave me support, and I will read it afterwards in English. But I will share those pictures, and these pictures are of course not clinical photos. These are all pictures taken by the mother, and she was so involved and so committed with the treatment that she all the time sent me pictures from her child at home and how the treatment was progressing and how happy she was with all the results of the treatment. and how she was feeling after surgery, and asking for support. And then she sends pictures from the child from home, and how she looks, and how happy she is, and how she's growing and growing, and the mom is so happy. And then she wrote this, and you can read it, but she said, "Marina, from the first moment you have been a huge support, not only with Laura's treatment, but in many situations we have had." And sorry, I get a little bit emotional. She had really a lot of other health issues, and they have to face unknown situations. And she said that I gave her always a unique confidence, not only due to my expertise, but through love and care. And I think that's so important now, to really be committed with the whole treatment and with the people you have in front. It's not just a treatment. I think that's really important. When we teach NAM, we usually work with orthodontists, and they are more focused on treating bigger children, now 5, 6 years or older. And when you work and when you decide to do NAM with newborn babies, I always try to transmit them that we have to take care of the child also. And I think that's one big advantage for me as pediatric dentist, that I'm more used to work with babies. But I think everyone who really wants to do this treatment can get all the skills to do it properly. So I encourage every one of you to support your patients and to really take care of them. And that means that you sometimes must to get involved a little bit more than only with your professional skills, but always also with your emotion and being there for them. Most of my patients have my personal phone numbers, so they can ask questions at any time. And today with all the technology and WhatsApp and all that stuff, it's so easy to give them support. So I invite you to do this if you have the choice and you want to do it. And so we really try to do everything for our patients, for our little childs who grow, and then they came to our praxis or to Fundación Gantz, or we see them when they are doing speech therapy or other procedures in Fundación Gantz, and we see how they grow, and they are always loving. And the parents, they try to explain them that we were part of the first stages of the treatment, and we were there for many months trying to get the best results. So thank you for listening and for being part of the Comprehensive Cleft Care. Thank you very much.
Thank you, Dr. Marina. We're delighted to have been able to hear from your thinking and from your experience, your long experience in comprehensive cleft care. As is our tradition here at the Circle of Cleft Professionals, we'll now have about 25 minutes to be able to talk more with Dr. Marina about her practice, but also thinking about our own context, especially now, where many of us are very limited in what we can do in terms of outreach to patients and families. We can be thinking about how some of these principles that Dr. Marina has presented so well to us apply to our own context. So if you'd like to use the chat feature, you can write your questions out, and we'll present them to Dr. Marina as we're able. If you'd like to signal that you'd like to ask a question yourself, you can turn on your video, and we'll keep a list of who can ask questions so that we can spend our time well. If you're not asking a question, just ask you to keep your microphone on mute so that we can continue to hear each other well. And so I'll get us started here. Dr. Marina, my first question as we get started here is just going back to one of your first observations. And that, what really stuck out to me was how many of your patients start off the process by talking about my poor child, you know, and how limited and just being really overwhelmed by the experience. And around the world, I think that's a common, you know, concern. Can you say more about how professionals can model and really meet parents where they're at, but also how important it is, in your opinion, to move away from that idea of my poor child, my poor child?
Well, I think it's one of the most important things to move out from this feeling. And first of all, I think we have to understand why this occurs. No, parents are dealing with grief. Sometimes it was unexpected. When it is the first child, they really want to have a healthy child, and of course probably they say poor child because they feel poor, they feel abandoned by the creation. Or why me? Why I have had this experience? And so they put all their concerns into the baby. And the grandparents, they are great saying, oh, my poor child. So sometimes we have to be a little bit hard and say, you know what, stop it now. So sometimes you say it very kindly, but when you see you don't have a response, sometimes you need to be a little bit more harder, always loving, but strong, you know, and to clarify them that they can do all the difference in the future of the child.
Thank you.
If they stick with the poor child, it really will be a poor child.
And I think just connected to that, and we've got a couple technical questions on NAM that we'll deal with in a second, but I was really struck by how important you said it is to have that team approach, that it's not just the doctor giving this message or you as the pediatric dentist or orthodontist, whatever, but that importance that the family is hearing a consistent message, and the message is that this is a team. It is not one specialist from the God who's going to solve everything, but that messaging is coming from everyone, and everyone has a role to play in their child's rehabilitation.
Well, I think that's a real challenge for every team, because surgeon and the surgery is always probably the most impactant solution during the treatment, you know, because the child went into the theater with the cleft and then he goes out without a cleft. So for many, many years for us, and I think that's a fact in every team, the most important person in the team always was the surgeon. And I'm not saying he's not, no, please. We love our surgeons, but it's so important to talk to them, to let them know that every step has its timing, because before the mental focus was put on the surgery at the 3rd month, and it was like a rule, and it was unbreakable, and we had to let them know that if we will perform pre-surgical orthopedic or any kind of orthopedic, we have to wait until the treatment is ready. And sometimes, and depending on the cleft and this situation of each child, it can be take a little bit longer if the child is at the hospital because it has any illness, or the mother was too depressed at the beginning and the treatment is working a little bit slower. We have to understand this, and the surgeon is the person who sends the child to us because he's convinced that's the best treatment before the surgery. And so we really now decide together what's the best timing for the surgery, and they respect the timing. Many years ago, sometimes we were doing NAM and suddenly the patient disappeared, and I said, what's going on? And they said, oh no, he had surgery 2 weeks ago. And I said, why? The treatment was not ready. And today, I would say we haven't had this situation, never again.
Wow, so it's been a steady progress.
Yeah, and I would say for many years from now. So we really have improved the teamwork. And we also have had a lot of support from other people in the team. Our speech therapist said, why you don't put some, I don't know the word for rugas palatinas, so that the appliance is not so polished, because if you take your palate, the palate is not polished. So we added some irregularities on the plate, and the baby can develop better the propriosensitivity. So we have been working together. We have learned a lot also from the kinesiotherapists, because they teach us how to manage all the tissues, and after the surgery have to manage the scars. So the nurse are always there supporting us. So, and we support the other part of the team, and we encourage the parents to really attend all the other specialties to really have a good final result. So
it's been a long, so it's been a long process, obviously. Go ahead. Yeah, of building that teamwork, making sure, as you're saying, that it's not just, oh, it's the pediatric dentist who does NAM or just the orthodontist who does NAM, but that sense that all of the specialties have to be aware of what each other is doing so that they can reinforce the messaging and even improve each other's work.
Yeah, indeed, if you see the presentation, had a lot of slides who were given to me from Dr. Giuliano, or from our nurse, or from our staff. So we really not only work in the professional area with the patients, but also in the training and in our presentations, we also work as a team. And I think that's really important. And it gives us as a team, it gives us more confidence. So we know exactly what the other is doing, how we can support them, and vice versa.
Thank you. All right. Well, I think maybe we'll circle back to this team-based and psychosocial support, because that was very stood out for me. But we do have a few questions, technical questions about NAM as well. So the first one is just, at what age do you usually start NAM, and how frequent are your NAM appointments in Santiago de Chile?
Well, we try to begin with the NAM during the first 15 days of life. Many times, as I told you, we see the newborn baby at the hospital. But the idea is to begin hopefully before the day 15 with the treatment. We usually see our patients every week. If they come from further, we try to see them every 2 weeks. It depends a little bit. We have patients who have to travel really almost a day to go to Fundación Gantz. So that's why we try to adjust the treatment to the real options and possibilities of the patients. But the normal is we see them once a week, and depending of the distance of the gap, the treatment will be shorter or longer, but usually in a unilateral cleft between 3 and 4 months, and in a bilateral between 4 and 6 months.
Thank you.
And now with all this situation, we are really in a challenging time, but at least in Fundación Gantz, we still see the patients with NAM. All the other procedures are stopped at the moment. We are looking after the newborn babies and the children with NAM treatment.
Thank you. And thank you for that connection into this challenging time. So it's interesting that at Gantz you're still able to continue with NAM as an essential service. But just for everyone's benefit, we will, as the sponsors of the Circle of Cleft Professionals, be focusing in even more on how do we cope, how do we plan in this time of COVID-19. But back to another technical question. So that was from Dr. Manu in Mysore, India. Dr. Julio in southern Argentina asks, what is the rate of aligned premaxilla that they obtain with NAM before surgery in bilateral cleft cases? So very technical. Should I read it again?
Oh, very, very technical, really. Well, the bilateral cases are always our biggest challenge, I would say. And sometimes you you have a goal with the treatment, but you have so many different factors that you not always can obtain the best result, and you cannot always align the premaxilla as you would like to do it. But I think the important thing is that you can put them in a better position. And if they are in a better position, and you also can work with the soft tissues, because we not only need to put the premaxilla in the best position, we also have to work with the soft tissues that are a big issue also in the bilateral cases. And the other important fact, I would say, I'm not sure of the percentages now of alignment, but I would say we can do it at least in 60% of the cases, or probably more. I will not say more, because then you will say, you said that, but at least in 60% of the cases, we really have a very, very good result. And then...
That's great.
Yeah.
Thank you. Dr. Julio says thank you. Circling back to India, to Bangalore this time. So his question, and that's Dr. Jayanth from ABMSS, asks, do you have regular team meetings? And how do you discuss particular cases, as a pediatric dentist, with, the connection to the other specialties that you mentioned?
Well, we have regular meetings once a month, but if we have a doubt with a patient, we have two options. We really know very good each other in our team, so we are very familiar, and we feel free to talk to each other at any moment. When I'm in Fundación Gantz, we always have a surgeon there, so if we have any concern or doubt, or he has some, we visit each other in our workplaces, so we can discuss the situation at the moment. If there's a problem with the skin, or there's a problem, there is some bleeding, or any problem with the patient, we are there. So we try to solve it at the moment. And if we have a more complex case, we do a special meeting, and sometimes just using the technology, or sometimes in person. So it depends. We really are very open to use different ways to do the best for the patient.
Thank you. There's been a couple questions in the chat around the kinesiotherapist. I know Mirta answered on your behalf a little bit earlier, but you've touched on it. But can you say a little bit more about this role in the CCC team?
Well, for us, it always has been really important, but it's really relevant when we have a more fibrotic scar, because we know that it will not get solved by itself. So they help us, and we have a team working with us in Fundación Gantz, and they have been very supportive. And they also teach us how to manage the tissues a little bit before, and sometimes you can do some massage or some movement with the lips to improve the position of the muscles before the surgery, and then after the surgery, of course. So we work together, and not all patients go to the kinesiotherapy treatment, but if they need it, we can send them there, and they will get the best results.
Thank you. Marina, I found it really moving, obviously, that you focused on moms and parents near the end. And this is probably one of the bigger learnings that I've heard from several places around the world. Just, with the intensity of NAM and that pre-surgical treatment that you talk about, can you say more about what it means to have parents to really have a role right from the beginning? I mean, you mentioned that you meet with parents as early as 15 days from their newborn, and you've given them something to do. So can you tell a little bit about your experience with having parents have this practical thing that they can assist with the NAM appliance, and then how that leads into proper CCC care through their whole child's journey?
Well, as I said, when we really can have the parents involved in the treatments, they will be the best part of the team. So because they really, and they say, I would like to do maybe the adhesive system, I would change it that way, or maybe we can do that, or if sometimes we don't have the resources and the parents say, you know, I found that adhesive that is cheaper, or we found that one that is more expensive, but it's better for the tissues. And so they really help us. And if you see them each week, you need to, I feel that if you look at them, really you look at them, you can learn so much of what they are feeling and how we can support them. Because then we will really, they feel so committed and they feel really happy that they could do something. They were part of the treatment. They were not just looking to someone else to solve the child's problem. They are part of the solution. And I think that's a big difference, because when they really get involved, and we tried to do this when we only did pediatric dentistry before NAM, we really tried to make them part of the treatment, that they feel that it is safe to do any procedure in the mouth, in the child's mouth, without harming them, because they are always afraid to harm or to produce some pain, or that maybe if they clean the mouth it will bleed or whatever, you know. The imagination is not always our best friend. So we really try to explain them, to show them how to do it. Please repeat it after me, do it. I give the bottle and then they do it in my presence. So really we try to give them confidence, and when they feel confident, they are really very available to support us.
Thank you.
To support themselves.
No, it's fascinating. Very good. So I've got two more questions. One from Ljubica Radic. I said she could be next, and then we'll hear from Panawan after that. Please. Ljubica, what's your question? Oh, well, while we wait for Ljubica, we'll go back to Panawan's question about genetics. You mentioned on the team at Fundación Gantz, there's genetics. What's their role, and is there a connection to prevention?
Well, yeah, the geneticists, I think always they are so clever, no? They have so much knowledge, and of course, well, they support us as a team, but also the parents. When there is any genetic compromise of the child, they give support to the parents. If there is some syndromic issue, of course, they are more there for the parents because they need more information, or do some exams to know why or what is going on, and to really to support some diagnosis you are giving with exams. No, so the word is not exams in English. The word is
tests. Yeah.
Tests. Yes,
yeah,
thank you.
Tests.
So it's important, and of course they give a lot of support for parents in relation to maybe another child, if it's secure for them to have another child, or what are the risks of having another child born with a cleft or with another anomaly. So they are really supportive for the team and for the parents.
Thank you, Dr. Marina. Well, our time is running down. We have two questions really around motivation, around parents again. One from Mysore, another one from Ljubica has weighed in. So how do you keep parents motivated to continue with these treatments, these frequent treatments? And then what do you do if parents really are not responsive or not invested in the NAM, the pre-surgical process?
Well, I will start with the second question. Yeah. I think we as professionals always are focused to do the best for the best results for the child. And sometimes we have to be very humble and understand that the parents are not available for any treatment, that they only are looking for the surgery. And if we continue to doing NAM, we are only producing a big problem, and they are not sticking with the treatment. They are not using the appliance. And when we find this out, that's why we need to always to look after what's going on with the treatment, with the child and with the parents, how they act, what they tell you. If they say, no, yes, he uses the appliance, and you take the appliance and see that the child is happy, if you take it off, you clearly see that the patient is not using the appliance. So that's why it's so important that we really are very observing what's going on. And when we find out that the patient is the parents or the caregiver, no, because it's not always the parents, they are not able to perform the treatment, we just stop it. Usually it occurs when a mother has a very big depression, or when they come from very far away, or where they really don't understand the importance of the treatment. So that's when we go in, that's when our role is so important, that we really explain them why we are doing this, how we are doing it, how long it will take, what we can expect from the treatment, and so on. And when they see, because when they clean the mouth of the baby, they can see the progress of the closing of the gap. And they are so happy when they find out that the cleft is closing. And when they see that the nose has changed from one week to the other. So I think the best we can do is really to do a good treatment. So when we manage a good technique, and we are aware of not provoking any pain to the child, because when the child has some pain because we are not doing it properly, because it's not because the baby, when there is an injury on the tissues, usually it's our fault. So we have to be very aware, and we have to be really looking after any details to avoid any problem with the child. If the child has no problem, the treatment will usually be 100% successful. If we don't do it properly, if the child has bleeding or some injury in the tissues, or we don't give them the proper support to manage the problems properly, we will lose the parents and the child.
Thank you. Thank you, Dr. Marina. Well, I think this discussion could go on for quite some time, productively. There is so much experience that you have, Dr. Marina, and we're so grateful for the way that you've presented it and shared it as an encouragement to us, even in this time where some of our normal principles are not working. And we know that in many of the contexts in which the professionals on the call today are working, they're not able to continue with even the basic pre-surgical care right now. But as we prepare for what's next, this is really important to keep in mind, and we're so grateful for what you've shared today. Just in the last few seconds we have here, so this webinar has been recorded. I'm sure that those of you on the call will say, I have colleagues who need to hear this, or I have a surgeon or a team member who would love to hear a little bit more from what Dr. Marina has said. That will be available both on Slack as well as on our YouTube channel, and we'll be letting you know a little bit more about that right now. The Circle of Cleft Professionals website has just been in the process of being refreshed, so if you haven't visited cleftcircle.org recently, I'd encourage you to do so as we continue to build out resources, including ones on how to manage amidst COVID-19. Coming up, we'll talk a little bit more about ethics in rehabilitation from a world professor in rehabilitative ethics. And so we're hearing from Dr. Matthew Hunt coming up on May 5th. And then even a little bit shortly after that, Dr. Karen Chung, a surgeon scientist at University of Toronto and Sick Kids Hospital, will be sharing from her PhD research on measuring cleft-related quality of life. So how do we make those cases, both in terms of how to prioritize cleft care coming out of a COVID-19, but also how do we make the case to our own governments or to our own provinces about the economic benefit of providing comprehensive cleft care to patients. So you won't want to miss either of these upcoming webinars, and please stay tuned for other ways that you can be involved in the Circle of Cleft Professionals. So that brings us to the end of our time today. Again, a huge thank you to Dr. Marina. I see in the chat that there's lots of thank yous coming through from Tim in Toronto. Thank you for an interesting webinar. Surgeons who need to see this in Eastern Europe, that's wonderful. There's some questions around focus groups, etc. So for these ongoing questions, please go on to Slack, and our team is available to help you. I'm delighted to introduce a new colleague. Her name is Niti Daftari. Niti, do you want to say hello?
Hi, everyone. Lovely to meet with you. This was such a lovely webinar. Thank you so much, Dr. Marina. It was great to have you here, and we've all learned so much.
So
at the distance.
Thank you. So Niti is our new global program manager for global initiatives at Transforming Faces, and she'll be giving some leadership to the Circle of Cleft Professionals, including what's happening on Slack. So we invite you to move some of these conversations there, and we'll make sure you get the responses or discussion. Hopefully we can take it from here. In any case, thank you, everybody. We're thinking of you amidst this challenge. We're really grateful for your work, and we hope that we'll see you again shortly. Bye, everybody.
Thank you, Hugh. And thanks to all my team.